Hi guys, welcome back to my YouTube channel. So it's Hey Felicia here. Guess what we're talking about today? Yes, erectile dysfunction. I know most men are suffering from this, and then most tend to suffer in silence. Let me reintroduce myself. So I am Dr. Felicia Nyako, currently in the urology department of my hospital. I've seen quite a number of men report to the clinic with this issue, and then I just decided to shed some light on it. Okay, I hope I'm able to explain and educate you guys on the causes and the approach and the treatment of this issue. Okay, so without wasting much time, let's get right to it. Yes, what is erectile dysfunction? So erectile dysfunction is the persistent inability to achieve or maintain an erection which would be firm enough for you to have a sexual intercourse. That is basically that. So before we delve deep into our main topic, I would want us to talk or discuss sexual response cycle. So the sexual response cycle is made up of 4 phases. The excitement phase is the plateau phase, the orgasmic phase, and resolution phase. So during the excitement phase, you're happy, you're excited, you've seen something, you've watched something, your partner has touched you, someone is touching you somewhere, your heart rate is high, blood begins to fill wherever fillable. So for men, the blood begins to fill the penis. So you are so excited, you are ready for this. So for the plateau phase, there's a surge in excitement, like everything is at its peak. Then during orgasmic phase, muscles contract involuntarily. So the man will ejaculate to release sperm, and the woman will have vaginal contraction of the vaginal muscles. The resolution is when everything goes back to normal. Then next, I would want to talk about the anatomy of the penis. So if you can see, there are 2 big circles and a small circle. So in the 2 big circles, they are called the corporal cavernosum. So these 2 big circles have an artery. You see the small dots inside, those are arteries, and it has smooth muscles around it too. So around this big circle are small vessels called venules. So you know what happens is, and hold on, the very small circle there, you see that shape inside, that is your urethra. Urine passes there. So during the excitement phase, yes, the arteries, the smooth muscles of the arteries relax and blood begins to fill it up. So you see there's a surge, there's push of blood into these arteries. And as blood begins to fill these arteries, it expands and it compresses on the small vessels surrounding it. That way blood is not able to leave. Yes, blood does not leave. So we have so many causes. So I would want to start with the psychosocial causes like sexual response anxiety, relationship issues, stress, depression. Yes, all these things, if one is suffering from them, could lead to erectile dysfunction. Then too, we have the vascular causes. So if there are any issues with the vessels, you could also have an erectile dysfunction. One major thing is atherosclerosis. So what happens in atherosclerosis is that cholesterol plaques build up in the walls of the arteries, which then leads to hardening and narrowing. When this happens, not enough blood will be able to flow through the arteries for you to have an erection, basically that. Then also, anybody suffering from diabetes, diabetes also affects the vessels and the nerves. And then also some diseases like chronic liver disease, chronic kidney disease. Yes, all these problems could cause one to have an erectile dysfunction. Medication. So certain medications are seen to cause erectile dysfunction. Examples are beta blockers, diuretics, and also anyone with an enlarged prostate sometimes we put them on certain medications, and one of them, known as finasteride, could cause erectile dysfunction. Or yes, trauma to your pelvis, or a fracture in your penis, or an injury to your spinal cord could also lead to erectile dysfunction. So another cause is when you have certain hormonal issues like low testosterone levels, hyperprolactinemia, all these issues. When you have them, your doctor will be able to diagnose and let you know how to go about it. Yes. Also know that most men with diabetes tend to have erectile dysfunction 10 to 15 years ahead of any other man. Yes, it's one major issue. So the moment you notice you have an issue like this, don't stay at home. Just walk to the hospital. There are special doctors trained to help you solve some of these issues. So the doctor will ask you some questions, examine you, and ask you to do some investigations, which will help us get to know the root cause of your erectile dysfunction. So for the treatment, one, I want to start with lifestyle modifications, eating healthy diets, exercising a lot, quitting smoking, quitting taking alcohol, and trying to lose weight by exercising. These simple things could be done to help resolve your erectile dysfunction. These oral medications are known as phosphodiesterase 5 inhibitors. So what they do is they will cause the arterial walls to relax and dilate, and more blood will be able to fill the penis for an erection to occur. And a very common example is sildenafil or Viagra. Yes, but know that Viagra cannot be taken more than once, and it usually lasts for 4 hours. And also, simple side effects are headache, you can have some facial flashings, runny nose, and you should not consult your doctor before you start taking it, because sometimes when you're taking certain medications, you are not allowed to take Viagra. So it's always best not to start by yourself. You should see a doctor who can prescribe it for you to start using it. The other options are a vacuum hollow tube. So another thing is the urethral suppositories. So these suppositories are inserted through the urethra to cause an erection. They usually start working between 5 to 10 minutes. Yes. Another thing too are the self-injection. So these injections, normally you inject the corporal cavernous, there's actually dilatation, and then infilling of blood and an erection occurs. The other option is the penile implant. So this one, your doctor will take you to the theater to insert a machine which will help you achieve erection. And last but not the least, sex therapy, or seeing a therapist in general to talk about your issues, whatever you may be going through. Seeking therapy helps too. There are certain misconceptions I would want to clear. So one of them is people thinking that men below the ages of 30 can't have an erectile dysfunction. No, there have been studies showing that even younger men between the ages of 20 to 30 could have this issue. And another misconception is there are natural remedies to these things. No, there are no natural remedies. Just walk to the hospital and your doctor will be happy, very happy to help you resolve it. And yes, another misconception, people usually assume that the fact that you are having an erectile dysfunction means you are infertile. No, having an erectile dysfunction does not necessarily mean you are infertile. Before we diagnose a man as being infertile, we would have conducted certain investigations to have come to that conclusion. So yes, they are not the same. This is the end of the video. If you have any questions or concerns, you can kindly put them in the comment section and I'll be willing and happy to help you. Okay, and if you've been able to watch up to this point, I believe you've enjoyed the video, so why don't you just subscribe so you get to enjoy many more amazing videos as these. Thank you so much for watching, and thank you so much if you've already subscribed. Don't forget to like and comment and share. Okay, so see ya in the next video. Bye.